Hello everybody, so this is chapter 1 of the ServSafe Coursebook that we're going to go over, and it's keeping food safe. Some of the objectives are challenges to food safety, the cost of foodborne illness, because it's not just getting people sick, it actually is a monetary value to a lot of things, contaminants that can make food unsafe, and how to determine when a food illness is and how it has occurred. Some more is how food becomes unsafe, which foods are more likely to become unsafe, certain populations, who they are and how are they more likely to become sick, and food safety responsibilities of the person that is in charge of the restaurant. So what is a foodborne illness? A foodborne illness is a disease transmitted to people through food. How it happens is an illness is considered an outbreak when there are 2 or more people that have the same symptoms after eating the same food from the same establishment. An investigation is conducted by the state and local regulatory authorities. So here in Georgia, it's called the DPH, or the Department of Public Health, and the DPH will take samples of the food that is suspect, and it's confirmed by a laboratory analysis of that food. So there are a lot of challenges to food safety. So time, language and culture, literacy and education, pathogens, buying food from unapproved suppliers, those same high-risk populations and customers, and staff turnover. Language and culture is a huge, it could be a huge problem, because a lot of people, if they work in the kitchen coming from a different country, they may not speak the language of the country they're working in, and there's always a type of overlap of understanding that they might not understand what is going on. Literacy and education, if people do not know how to read, write, tell time, that is also a huge problem. Unapproved suppliers, you want to make sure you buy food from approved suppliers, so local supermarkets, so Winn-Dixie, Publix, Super Walmart, Aldi, Super Target, or commercial-based vendors like US Foods, Gourmet Foods, Febreze. All of those vendors have to meet certain laws. So cost of foodborne illness, like I said earlier, it's more than just getting people sick. It actually costs money. So the first one is loss of customers and sales. So if there is a confirmed outbreak at your restaurant, customers and people may not want to come to eat your food because they do not want to get sick. So if customers do not come, they do not bring money, they do not buy food, so all your profits start decreasing. Loss of reputation, that's just, you could be really well known for a very, very long time, and then all of a sudden people get sick and no one wants to go there because people got sick. Negative media exposure, nowadays everything is very easy to get accessed online, in the news. Everybody has a cell phone, smartphone in their pockets, and if something's bad, it gets spread like wildfire. Lowered staff morale. If the staff has a job and no one comes into that job, they're not making money, they may want to leave, and everybody needs money to survive. Lawsuits and legal fees. If people are getting sick, these people could potentially die, and if those customers do die, their families may try to sue the restaurant itself, their insurance policies, and a lot of times the legal fees have to be covered by the party that got the customer sick. Staff missing work. If people miss work, they might not be up to date on certain policies and procedures in place, updated safety food codes, or just remembering what they need to do daily. Increased insurance premiums. If restaurants get sued, their insurance are the ones that pay. Once that insurance pays the party of the people who got sick, the insurance premiums for the restaurant go up because they need to recoup that money. So if your insurance is about $1,000 a month, it could go up to $1,500, could go up to $2,000. So it could go up substantially. And the last one is more staff retraining. So if people get sick constantly, you might need to continuously retrain your staff until they understand the importance of food safety. So how can foodborne illnesses occur? Victims of foodborne illnesses may experience loss of work because if they're sick, they have to stay home. Medical costs, sometimes it's short and long-term disability, mentioned right there, so they have to go to the hospital. And the last thing that could potentially happen is death. People can die because of foodborne illness. Unsafe food is usually the result of contamination. So when good food has been touched or leaked on by bad food, and contamination is, by definition, the presence of harmful substances in food. So unsafe food is the result of 3 categories. There are biological, chemical, and physical hazards. So let's take a look into some biological contaminants. So there are 4 subcategories under biological. There are bacteria, viruses, parasites, and fungi. For chemical, there are cleaners, so soaps, detergents, sanitizers, which reduces the number of pathogens, but can still get people sick because it is a chemical, and polishes like silver polish, stainless steel polish that gets into food. Per the picture on the slide right now, you see food that is not covered properly and someone is spraying a liquid, and if you look close enough, that liquid is blue. So obviously that is a chemical that's getting sprayed onto food that people will be eating. The last one is physical hazards. So some of these could include metal shavings, staples, band-aids, glass, dirt, natural objects. Pretty much by definition, physical means anything that is not supposed to be in the food, So it has to be all edible, so nothing else can be in there. So paper, plastic, eyelashes, hair, all of those are considered a physical hazard. 5 factors for foodborne illness. So this is a big one. So the first one is purchasing food from unsafe sources. You do not want to buy food that you're serving in a restaurant from someone selling it out of their back of their car on the side of the road. That is a unsafe, unapproved food source. You do not know if they have any licenses, where they got it, how long they've had it for. So it can be really bad. Next one is failing to cook food correctly. Every food has a minimum temperature that it should meet to be safe to consume. Holding food at incorrect temperatures. There is the temperature danger zone, so you do not want any food to be stored in that zone, and it's from 41 to 135. So if you have hot food, it has to be stored over 135, and cold food has to be stored under 41 degrees. Using contaminated equipment. So this is just how it has not been cleaned and washed properly, or it was cleaned and washed properly and it got contaminated by food by dripping on it, or it wasn't cleaned properly. And the last one is practicing poor personal hygiene, so not taking care of yourself as a food handler before you come into the restaurant. So if you have cuts on your arms, they're not covered, you sneeze into food, you wear the same dirty clothes to work all the time, you don't wash your hands, it's a very easy thing to take care of yourself. So how can food become unsafe? There are a lot of different ways. So time, temperature abuse, cross-contamination, poor personal hygiene, and then poor cleaning and sanitizing. So what is time, temperature abuse? So time, temperature abuse is when food has stayed too long at temperatures good for pathogen growth. So like I said earlier, there is the time temperature danger zone. It's 41 degrees to 135. If you cook chicken, which should be cooked to 165 properly, and you hold it, and then all of a sudden you take a temperature, and that chicken is no longer 135 or above, it's reading 120, that food is now unsafe because the time temperature abuse of what happened. It's below the temperature that it should be for longer than it should be at. And bacteria love to grow in the temperature zone to get people sick. Food has been time temperature abused when it has not been held or stored at the correct temperatures. Food is not cooked or reheated enough to kill pathogens, so it's not heated hot enough. and is not cooled correctly. So it's not broken down into smaller containers. It's not passing through the temperature danger zone quickly. It could just be sitting at room temperature, slowly getting cooled, and 100% of the time, room temperature is the temperature danger zone. Cross-contamination is defined as when pathogens are transferred from one surface or food to another surface or food. So like the picture shows, there is lettuce, which is considered a ready-to-eat food, with blood drippings from another food that was obviously stored above it. This means that this lettuce, as shown in the picture on the sticky note, is no longer safe to consume. Even though it is wrapped in plastic, it is not safe to consume because there could be microscopic holes in the plastic. So this will have to be thrown away. Cross-contamination can cause a foodborne illness for many ways. Contaminated ingredients are added to food that receives no further cooking. So those are classified as ready-to-eat foods, as the lettuce. Ready-to-eat food touches contaminated surfaces. So you could be cutting chicken on a table on a cutting board, and someone moves it, and you take a cake or a pie and put it on that same cutting board or table that has not been cleaned or sanitized yet. And so now there's a chance of salmonella going onto that pie or cake. Contaminated food touches or drips fluids onto cooked or ready-to-eat food. Example is the picture. A food handler touches contaminated food and then touches ready-to-eat food, so raw ground beef in a pie. And then contaminated wiping cloths touch food contact surfaces. So if you used a cloth to wash your table, you didn't put it away properly, and then somehow that cloth touched clean cutting boards. Poor personal hygiene can cause a number of foodborne illnesses. Some examples are when food handlers fail to wash their hands correctly after using the restroom, which you should do all of the time. Coughing or sneezing directly onto food, which happens more than you think. And touching or scratching wounds that are on their persons and then touching food. And then another big one is working while you are sick. I know a lot of times people do go to work sick, but if you have vomiting or diarrhea, you should stay home. If you have a headache or a sore throat, you can work as long as it's not with high-risk populations, but most of the time, if you are sick, you should stay home. Poor cleaning and sanitizing, so equipment and utensils are not washed, rinsed, and sanitized in between uses and kept where they won't get dirty or contaminated. Food contact surfaces are wiped clean instead of being washed, rinsed, and sanitized, so you're just wiping it to make it look clean instead of actually doing the whole process. Wiping cloths are not stored in a sanitizer solution between uses. In class, we use a spray bottle, but depending on where you work, you'll have a red bucket that's for sanitizer, and you keep a cloth consistently underneath the level of the sanitizer in the bucket. And then sanitizing solutions are not at the required levels. This just, if you've ever taken chemistry, it's ppm, so parts per million. That means there's a certain amount of sanitizer parts per million parts of water. And usually you can contact the company or read the bottle, and it'll tell you how much per water should you use. There are two types of food that will be likely to become unsafe. These are TCS and ready to eat. So next slide, we're going to go to TCS. By definition, it's food requiring time and temperature control for safety to limit pathogen growth. So T, time, and T, temperature. C, control, for S, safety. So time and temperature control for safety. Some examples of a TCS food are dairy products, so milk, cheese, eggs, or milk, cheese, and other dairy products. Eggs, which are separate. Meat, poultry, fish, and shellfish and crustaceans. Baked potatoes, cooked pasta, cooked rice, cooked vegetables, cooked fruit, tofu or other soy protein products, sprouts and sprout seeds, cut leafy greens, so cut lettuce, cut melons, and cut tomatoes, and those are fine until they are cut. Once they are cut, they become a TCS food. And then the last one is garlic, unheated and untreated garlic and oil mixtures, because the garlic interacts with the oil and can cause reactions that can cause people to get sick. Ready-to-eat food is defined as food that can be eaten without any further preparation, washing, or cooking. So the cookies that we made the other day, everything you could touch, but once they were baked out of the oven, they were now a ready-to-eat food because they were baked, they were cooling, you were not going to wash them, and you don't need to recook them. Ready-to-eat foods includes cooked foods, washed fruits and vegetables, both whole and cut, deli meats, bakery items, sugar, spices, and seasonings that you put on food at the end as a finishing. So there are different populations that are high risk for foodborne illnesses. So the immune system is what keeps the body safe. So by definition, the immune system is the body's defense against illnesses. It's what fights it off. And these categories are at higher risk for getting sick from a foodborne illness. So there are preschool age children, and the reason why they're in here because they're very young and they have not developed strong immune systems yet. The elderly, because as they age, their immune system weakens and the stomach acid becomes weaker, so the stomach acid cannot possibly fight off any bacteria or immune systems that are in their body, and also their organs are getting old as well. The last category is people with compromised immune systems, so anyone who's going through cancer or chemotherapy, if they have HIV or AIDS, if they are transplant recipients, so they've had a heart transplant, lung transplant, kidney transplant, those are all, those people can get sick. And depending if there's any certain types of medication you're on. I'm not sure of the list of the medications, but if you're on a certain medication, it can weaken your immune system and then you can get sick. So the person in charge of a kitchen should be certified in food protection manager. So me being the chef here in class, I have a ServSafe manager certification, and I also have certification to teach it and to proctor the tests. Must be on site during operating hours, so this means as long as that restaurant is open, one person should be in charge. It does not have to be the same person, but one person should be in charge at all times that has a ServSafe certification. And that shows that they have acquired the minimum amount of knowledge that they need to keep food safe. To become a certified food protection manager, you must pass a test from an accredited program. This program is accredited by an agency approved by a conference for food protection, and completing the ServSafe course and passing the ServSafe exam will meet those requirements, which you will take. Technically, you're taking the course now, but you're taking the test in culinary too. Why is it important to be a certified food protection manager? The CDC, so the Center for Disease Control, suggests that it helps reduce the risk of foodborne illness. The more people educated in food safety, the less likely customers and consumers will get sick. And it'll be a distinguishing factor between restaurants that have experienced employees with certifications versus restaurants and establishments that do not have employees with these certifications. The FDA, so the Food and Drug Administration, studies suggest that more effective control of risk factors for foodborne illness with establishments that have multiple employees with ServSafe certifications. Key practices for ensuring food safety is they focus on these 5 measures. So the first one is purchasing food from approved, reputable suppliers. They have to meet laws, they have to pass laws, they have to pass inspections. They have all the same rules that restaurants do, but more because they're giving food to restaurants. They have to control time and temperature, just like in a restaurant. Frozen foods kept frozen, cold foods kept 41 or below, and hot foods kept 135 or higher. Preventing cross-contamination, meaning ready-to-eat food is separate from raw food, raw chicken's on the bottom, glass bottles are on a separate shelf, everything is separated. Practicing personal hygiene is making sure you wear clean clothes, take showers, don't touch your hair, don't touch your body, don't sneeze or cough into food. And the last one is proper cleaning and sanitizing. Just because something looks clean does not mean it's clean and sanitized, because pathogens can still live on the surface. The FDA, so Food and Drug Administration, recommends responsibilities for the manager is food handlers are regularly monitoring food temperatures during hot and cold holding to make sure they're at the correct temperatures. Ensure food that is not prepared in a private home or where people live or sleep. They restrict people other than food handlers from prep, storage, and dishwashing areas. And they ensure maintenance and delivery workers follow food safety practices. And they monitor staff hand washing. Now, this is not an example of micromanaging. This is an example of just making sure the proper procedures are in place so no one gets sick. A micromanager would be someone that's standing right beside you as you're washing your hand with a timer, or telling you you're constantly not doing something right. This is just making sure that everything's getting done, and if it's not done correctly, they can educate their employee on the proper procedures. Monitor deliveries to ensure food is safe. So once again, approve sources, make sure it's the correct temperature. If you ordered frozen food and you received it and it was not frozen, you should not keep that frozen food. If it's protected from contamination, and it needs to be accurately presented. So if you order something food-wise and it's coming in a different container than it should come in because something happened to the container, you should not accept that food, you should reject it. Ensure TCS food is cooked and cooled correctly, so it's cooked to the required temperatures. Temperature checked with a calibrated thermometer, and that the food that is cooled rapidly and correctly. Ensure guests are properly notified if there's anything wrong. A lot of times on the menu, if you look at the very bottom with an asterisk, it says that consuming undercooked or raw food can lead to foodborne illness. So that is a warning that if someone orders a rare hamburger, they could potentially get sick. And that they use clean tableware in self-service areas. So if you've been to a buffet, every time you go to a buffet, you have to get new plates. Monitoring staff and ensure training on food safety practices, including cleaning and sanitizing, handling ready-to-eat foods, allergy awareness, and reporting illnesses and symptoms. If you are sick, you need to tell your manager. You need to stay home, or you need to go home. And that food safety procedures are written down, implemented, and maintained. You can display your commitment to food safety by offering training. Make sure nothing is expired and it's always up to date. Discuss food safety expectations. Document and maintain food handling procedures. Consider awards or rewards for good food safety records, and set a good example. So, another thing it goes on to say, but it's not in this PowerPoint, is the USDA. The USDA, the United States Department of Agriculture, is a department of the U.S. government that is in charge of inspecting and processing and making sure this is all safe. Meat, poultry, and eggs. They are required for that. So if you think about it, the USDA, if you think about it as a grocery store, the USDA takes care of all the food that's usually on the outside of the walls, or on the walls. So produce, meats, all the proteins, all the dairy, all the eggs. They are in charge of that. The FDA is in charge of all the food that's inside the grocery store in the middle. So cereals, supplements, box foods. So those are the difference between the FDA and the USDA.